Hello and welcome to Friendly Pharmacy 5. My name is Lindsay Dixon and I'm a pharmacist here in British Columbia, Canada. This is our very first live stream today. I thought I would come on because today is World Pharmacist Day. So many of you already know that I am a pharmacist here in British Columbia, and today is a day where we celebrate the work of pharmacists and the work that pharmacists have been doing. I really hope that this pandemic has shown what pharmacists can do, and hopefully in the future we will be able to be utilized even more as we are able to bridge gaps in healthcare. I think that pharmacists are one of the most misunderstood and underutilized professions in healthcare. So I come to you today during the fourth wave of the COVID-19 pandemic. Being in British Columbia, we are having quite a tough time in our hospitals, as is Alberta, as is Saskatchewan. Alberta is probably in the most serious situation right now with COVID-19, with patients being airlifted or starting to be airlifted out of the province because their ICUs are filling up so quickly. I would also like today just to give you some tips on what you can do this fall and winter to help keep yourself healthy. And this is not only in respect to COVID-19, but what you can do to try to keep your family healthy and try to prevent colds and flus, some of the things that I do and that I'm using for myself and my family. So this will be a fairly quick chat. Now, if you have questions, I do have the comments open. You can ask me anything about COVID-19 or about flu season, or really anything within my scope of practice as a pharmacist, or anything that we've covered on this channel so far. So I welcome your questions and your ideas. So for flu season, I was recently part of a conference call for British Columbia with the BC Pharmacy Association, and we know that flu vaccines, for those of you who are interested, will be coming out mid-October. And the flu vaccines that will be available will be quadrivalent. This means that they will cover 4 different strains of the flu. And I have those for you today. Now, I do have to read them because I cannot remember all of them. So the strains that will be in these flu vaccines are the Victoria virus, the Cambodia, which is the H3N2-like virus, the Washington-like virus, and the Phuket-like virus. There will also be Flumist available for children. So that's just the spray that goes into the nose for the children. With the Flumist, those will be available in limited quantities. I will tell you that sometimes we see more severe side effects afterwards in children with the Flumist. So they tend to feel more run down. Not all children, but quite a few. They tend to feel a little bit more run down, more side effects than sometimes with the injection itself. But it's really hard to give kids injections or vaccines sometimes. So I'm speaking of the flu vaccine. For those of you who have just joined me, this is our first live. Today is World Pharmacist Day. I'm going to give you a few tips on how to stay healthy during this fall and winter. I'm just touching on the flu vaccine because I was part of a conference call recently. And we know now that the flu vaccine will be coming out sometime in mid-October. We don't know the exact date, but for those of you who are interested, I was just giving a little bit of a recap of that. Now, there's a few things that I do myself during flu season and for my family, and I think it's good to kind of give everyone a reminder, and maybe you could share your tips in the comments. I can't see any comments coming in. If you can hear me, can you just post a comment and let me know, because I hope I'm not talking just into thin air, please. So just let me know that you can hear me and that I'm not just talking to no one here. So I'll just keep going. I don't see anything so far. Let's see here. Nothing so far. So I'm going to keep going. Oh, good. Iron Fire Horse, thank you for letting me know. That's helpful. I'm not just speaking into the abyss here. So I spoke a little bit about flu shots. In British Columbia, flu shots will be coming out mid-October, and they will be quadrivalent. Okay, so they will cover 4 different strains of the flu, and I already mentioned which ones those are. So the flu vaccine is one way that you can help to protect yourself from the flu. I would not be surprised if we saw quite a bit more flu this year because we have a lot more movement going on in society. And so that's something that you can think of, especially if you're over 65 or if you have any chronic health conditions or have anyone in your family that does. Okay, there's a little bit of a lag. Thanks for letting me know. That's really helpful. Hi, Curious49. Thanks for joining me. If you guys have any questions for me about COVID-19 or any health-related topic, please feel free to ask them. I want this to be able to be interactive. So one of the things that I definitely want to remind you of as we head into this fall season, let me know where you are in the world today. So some of you will be in Canada, but I do have viewers from different places in the world. So let me know where you're at. Are you heading into fall and winter, or are you maybe heading into spring and summer where you are in the world? So one thing that we cannot forget is vitamin D. So during the fall and winter months, I don't take vitamin D during the summer because I think that we get enough sun. I'm out quite a bit with my family in the summer, but during the winter months, I take the recommended dose of vitamin D, which is 1,000 to 2,000 units for an adult. Now, if you look at the health, hi, Florida, Central Ontario. That's great, you guys. Hello, welcome. This is our first live. Today is World Pharmacist Day, so I wanted to do something a little bit different. So vitamin D, I'm not recommending what you should take. You should talk to your pharmacist or healthcare provider about what dose is right for you. But during the winter months here in British Columbia, it's very dark, it's very rainy. We don't get out much, and we're always wearing a lot of clothing on our skin. So the sun does not get a chance to really get to our skin and produce that vitamin D. So I have no financial interest in this. This is just what I have at home. So I take 1,000 to 2,000 units of vitamin D a day. Sometimes if I forget, I'll take a little bit more than that. And my children, I give them a dropper, and it's 400 units of vitamin D. Washington State, welcome. Thank you so much for letting me know where you are. Let me know today, do you intend to get a flu vaccine? Or what do you do during flu season to stay healthy? So vitamin D is one of the things that I do. Now, something else that is really important is sleep. And we all know that sleep is important. I did a couple of videos on this, and I'll put links down in the description. One of the things that you can do is in the evening, you need to turn your phone on to night mode. So I have my phone on night mode. It goes on, you just go into settings and you look for night shift mode. London, is that London, Ontario? Or is that London, like as in Europe? Let me know. Hello, Mr. Ali. So I put my phone onto night mode at 7 p.m. And so if I'm on my phone or on my computer after 7 p.m., it shifts into night mode. And that helps to restrict the amount of blue light that you are looking at. And we know that blue light mimics the sun's light, and that can interfere with the levels of melatonin that our body produces. So that's a quick way to help improve your quality of sleep. Also, there's a few things you can do. Try to keep your room dark and cool. Don't have any screens or anything like that in your bedroom. Sleep is of utmost importance for immune health, for the body's ability to, the body's ability to repair itself during the night, and also for memory. England, hello, welcome. It must be, I would guess, 8 o'clock in the evening there right now in England, because it's 12 o'clock Pacific Standard Time here. Thank you for letting me know. So sleep is another one that's really important. I've already talked about vitamin D. Flu shots. Honestly, I personally, I'm fairly healthy. I don't get the flu shot every year, but I did get it last year just because we had COVID happening, and it's something that I didn't want the chance of having COVID and having the flu. And I will probably get it this year just because of the same circumstance. And my kids did get it last year as well. It's not something I do every year. Now, the National Advisory Committee on Immunization does recommend it for everyone over 6 months of age. But I'm just telling you what I personally do, and that's your personal decision. I'm not here to push vaccines on you. But in British Columbia, Alberta, Saskatchewan, we are seeing hospitals that are becoming quite full, and we do not need more people with influenza ending up in hospital. So that's one thing that you can do. Iron Fire Horse says, I don't usually get the flu shot, but I always take my mom to get her shot. And that's excellent, because the elderly people are the ones who are more prone to more severe illness, complications of influenza. And they are also the people that are less likely to have as strong of an immune response to, say, the COVID-19 vaccine or other vaccines. So that's great that you take your mom to do that. Definitely, we need to protect the people in our society that are more vulnerable. So we can continue talking about flu, about the winter months, and just keep your comments going in there. I did want to show you masks, okay? So I have a mask that I bought a package of these from Masks for Canada. Again, I have no financial interest in this. I just bought them for me. They're working really well, and I bought them for my children as well. I'll show you. These are made in Canada. They are N95 masks, and this one is a pack of 10. So I have a package of 10 for myself, and then I have a smaller size for my children as well. My children are fairly young. They're actually not required to wear masks in school, which I think is unfortunate and I don't agree with, but my kids are wearing masks in school, and the masks that I have here for myself are identical to the ones that they are using. So I'll show you this. Now, the thing about an N95 is that, yes, it will protect you from the COVID-19 virus, but it will also protect you from other respiratory illnesses that might be going around, like colds and flus. Now, this mask, I'm going to show you how it works. So when we open it up like this, it's got the wire right here. This was not expensive. I think it was maybe $15. Don't quote me on that, for a box. So I thought that it was quite, Brian Wild, good to see you. Yeah, good to see you here too. Thanks so much. Let me know if you have any questions. I'm happy to answer any questions. How are you doing in your part of the world with the pandemic right now? How are you guys doing out there? So this mask, I'm going to put it on me, and you can see this flap comes down under your chin. It looks kind of funny, but it fits very, very well. I'm really impressed with these. So this is Masks for Canada. So see how it goes over like that? I put it like this. I pinch it over my nose, and then see, you can kind of see here. So the thing about a mask is it's great that this is an N95, but a mask is only as good as its seal. So you really need to have it fitted around the nose, around the chin. How many of you still see people wearing their masks like this? Yesterday, I saw someone wearing their mask like this. So I know none of you are doing that. That was just a little bit of pharmacy humor for you. So these masks do fit quite well. However, I was walking downtown the other day. Masks do not stop all the smaller virus particles. What about buildup of bacteria for children using masks all day? Yes, and that is a valid comment, and I will talk a little bit more about that. So as I was saying, and this kind of plays into that comment. Thank you, Melamore, for that comment. The mask is only as good as its seal. Okay, so I thought that this mask was well sealed. Okay, and I was downtown the other day, and I walked out of a building. Now, outside, I don't usually wear a mask. 25% of people in the UK wear them wrong. Yeah, and I don't think Canada is much different, to be honest. We're better, but still, we could improve. So I thought this mask was very well sealed, and I was walking around with my N95. Now, I walked outside, like I said, and I could smell someone's cigarette smoke through the mask. Now, I have not looked up what the size of particle cigarette smoke is, but it really was very eye-opening, because I thought, okay, if cigarette smoke is coming through this mask, I can smell it very well, then this mask is probably not protecting me as much as I think. And I did go to a hospital the other day, and they actually asked me to take this off, and they wanted me to put a surgical mask on, which I also don't agree with. So what I did is I said, well, and they asked me if it was fitted to my face, and I said, well, I fitted it, because when healthcare workers wear these N95 masks, they obviously don't wear this one. They have it fitted to their face so it forms a seal. And many of you have seen those healthcare workers who have those marks on their face from the pressure of the N95 mask. So when I went in the hospital the other day, I said to them, no, I don't want to take this off. I'm not taking it off, is what I said. I'm a fairly easygoing person, but for things like this, I just don't see the point in cooperating. So I said, listen, I will wear my mask, and I put a surgical mask that they gave me over top. That's what I would recommend doing. If you are wearing a mask that is not an N95 or triple layer, or if you're going into a place where you know it's a crowded, closed space with lots of people, double mask. And I'm not saying double mask one of these, use one of these, use a surgical mask on top, or use a triple layer mask. And sometimes you can put even a paper towel filter in there. If the paper towel filter or whatever filter you're using gets wet, then it's going to lose its efficacy and it needs to be changed, okay? So I just want to go back to Melamorph's question here. Masks don't stop all the smaller virus particles. What about the buildup of bacteria for children using masks all day? So I can't speak too much to the buildup of bacteria. I mean, I know that your face has bacteria on it. We are all colonized with a lot of bacteria. Now, the masks are not 100%. They are one measure. Some of you may have seen the Swiss cheese model of all the different layers of protection that we use, and none of them are perfect, but all of them together help to provide more protection. What I do with my kids is I'll give them one mask for the morning, and then I know they take their mask off to eat at lunch, and then in the afternoon they have another mask. If they forget, because they do, and so do I, they do wear that mask, because I do think that something is better than nothing. And then they have a different mask for the next day. So that's what we're doing. And I am allowing them to reuse the masks after these masks sit for about 30 days. And I don't have science to back that up. That's just what I'm doing. So I'm a pharmacist in Algeria. People here this is Wildcan. People here are so careless about mask wearing. I basically gave up telling them to wear it correctly. Yeah, it's interesting because we see different places like in Taiwan where they always have worn masks during certain influenza or cold seasons, and they're so used to it. Whereas in different places of the world, the culture just does not seem to adapt as well to it. Keep telling them to wear their mask. At least I always think if just one person hears the right message, and if it just helps one person from getting sick, then all the effort is worth it. So I would encourage you to keep telling them. It is helpful. And even though masks do not prevent all of the particles, they are not a surefire way of not getting sick. One thing I do think they're very effective at doing, because I have seen the studies on it, is reducing the viral load. And the viral load, from what I've seen, has a lot to do with severity of illness, especially in kids who are not vaccinated, don't have any immunity. So let me just see your comments here. Hopefully the schools are ventilated. Exactly. So ventilation is huge. I know in my kids' school, they're leaving the windows open. Temperatures are fairly moderate here right now, but in the winter months, it does get cold, and they're telling us to send our kids dressed appropriately for the weather, but it is a concern. And getting a HEPA filter or something in the classroom, I think, could be helpful as well. Brian Wild says, when I do asbestos removal, I have to be clean shaven, and my personal mask is fitted to 25 nanometer size particles. Smoke particles go down to 0.1 micron. And if I remember correctly, I believe the SARS-CoV-2 virus is 0.125 microns, and some HEPA filters are able to remove that. So the point of the mask is to protect you and protect others. It's not perfect, but it does help to reduce the viral load. So if your kid is sitting beside another kid that has COVID-19, we know kids are often asymptomatic, then the likelihood of them getting as much viral load is lower because they are wearing something to protect their face. My opinion here is that, and it's based on data, is that something is better than nothing. So I just wanted to share with you these masks. I think they're very well made. They do fit well, but they're not everything. Like, you do need the other measures like social distancing and ventilation and avoiding closed, crowded spaces. Transmission via the eyes is also an issue, and I've spoken about that. I've shown you a video, I think maybe a few months ago, on some protective eyeglasses that I use when I give flu vaccines. We're in a very small, crowded space, and it is an issue. And if you're wearing those visors instead of a mask, there's been some engineers that have said that the way that airflow works is that the air is going to be, if you're wearing a visor, the air is going to get trapped up there. It's going to go right to your eyes. So eye protection is something that I know that they're using in hospitals here it was instituted in hospitals, I think 7 or 8 months ago, mandatory eye protection. So that definitely is an issue. Now, a few of you have asked me about mouthwash. So months ago, I talked about a mouthwash, and I have it here. This is the product. Again, no financial interest in this. This is a product that is based out of Brazil, and I interviewed the head researcher for this product. Now, this is a mouthwash, and they've done randomized controlled trials with this mouthwash showing that it does help to reduce the viral load. So it is antibacterial, but it is also antiviral. Now, they don't have the authorization, or the equivalent to the FDA has not authorized for them to market this as an antiviral right now. So it's just marketed as a mouthwash. The active ingredient in here, I'm telling you because some people have asked about the mouthwash. The active ingredient is something called phthalocyanine, which is a naturally occurring dye. And what this mouthwash does is it's activated by the molecular oxygen in the mouth. And they have shown in vivo, so most of the mouthwash articles, studies that you will find are in vitro, okay? But these people in Brazil from the University of São Paulo are showing that I will talk about Betadine in a second. Thank you for that, Melamarf. In vivo, they've shown that this reduces the viral load. They're now doing studies on this in different hospitals in Brazil. As you know, Brazil has had a really difficult time with the pandemic. So I talked about this with the head researcher. I interviewed him, and I'll put the link in the description of this. And I really was interested in the product. So they sent me some, and I've been using it. And I'll tell you, it's the best mouthwash I've ever used because it does not burn the mouth like most mouthwashes. And knowing that it does have this antiviral property is also helpful. Now, I don't sell this, and you cannot get this in North America right now. I am talking to the company because I really like it, and I would like to be able to, I don't know if I would sell it, but at least have a place where people could find it. But that being said, there are studies, and Betadine, now there are studies about different mouthwashes that can help to maybe reduce the viral load and reduce severity of disease. I spoke with the head researcher of this product, and he said, you know, even the physical washing of like a salt water solution would in theory be helpful to just reducing a viral load when you get even just symptoms of just a cold. So maybe this fall, this winter, you start to feel a bit run down, your throat gets a bit scratchy. Of course, you should get tested for COVID-19, but I would also recommend there is no harm in using some kind of a mouthwash. I wouldn't do this every day because it can cause the flora in the mouth to really be thrown off if you're killing off the good bacteria and just the balance there. But I definitely, based on the research that I've seen, and I'll put those links in the description after this live here, definitely think there's something to just helping to reduce and clean out kind of the oral cavity. Now, the other thing that the people from the research at the University of São Paulo with this product that they got people to do was they said, you don't just use it as a rinse, you also gargle with it. And when you gargle with it, that produces aerosols that are inhaled through the respiratory tract into the sinuses and could be helping to reduce the viral load as well. So no matter what kind of liquid you are using, make sure you use something that is safe and meant for this. Gargle and rinse is what I would do. And anytime I've had a little bit of a scratchy throat or anything like that since I've had this, it's been a few months now, I just use this. I get my kids to use it, and we've not had really any colds or flus. I'm not saying it's a miracle, but it is something that I'm really, really excited about, and I would love to be able to get this here in North America. Betadine is something that I saw came up a while ago, and not a while ago, actually, just a couple of weeks ago. I heard about it early on and then heard about it recently. Now, some people were drinking Betadine. I don't know if you heard this. Do not drink Betadine. Do not drink any kind of solution like this. It's not meant for that. Other people have asked about hydrogen peroxide. Hydrogen peroxide used to be used in wound cleaning, and it's actually known now that hydrogen peroxide actually destroys the living tissues that are trying to close up a wound. And it does also destroy living tissues, say in the oral cavity or wherever. So do not use hydrogen peroxide as an oral rinse. Betadine, I don't know of any I don't know off the top of my head, although I'm thinking of one that might be, that is made for oral use. So I do not recommend that. But the mouthwashes that you just get at any pharmacy, or even just a saltwater gargle, I think is quite helpful. It's inexpensive. It's a way to help prevent any kind of cold or virus. And I'll keep you updated on this product because I'm really excited about it. So, and they are actually in talks with Amazon with this product. So I will definitely keep you updated about this on the channel. So Brian Wild is saying, my daughter has to eat outside at school, which is fine, but soon it will be winter. There's no seating under cover. She will have to eat stood, packed like sardines with other children. Brian, I'm really interested in where you're from. So in British Columbia, it's really concerning because public health is not requiring cohorts of students anymore. So all the students can just kind of intermingle. Spacing between desks is also not required right now. Windows are open, but it's going to get cold. And so these are things that I really wish were different. And I'm advocating at my kids' school to help to try to change this, but it's really hard to see much movement. So everything that we can do to try to protect our kids, like wearing masks, advocating for good ventilation, anything that we can do is helpful. And I definitely sympathize with you, Brian. So let's just see here. I just read about Thrill 0415 says, I just read about saline solution being used for the nose during COVID. Yeah, and there actually is also a nitric oxide spray that a company out of Vancouver, British Columbia is working on that helps to reduce the viral load as well. If we can prevent the virus from getting in and systemically causing that cytokine storm, then I really think we can prevent the severity of illness. Now, I do believe that the COVID-19 vaccines are the most effective way of doing that. And I've had both COVID-19 vaccines. I actually will share that story with you in a second. But yeah, I don't see why wouldn't we use mouthwash? Why wouldn't we use a mask? Why wouldn't we, try to increase ventilation in an area, right? Let's just see here. Wildcan says, I'm still seeing some doctors prescribing azithromycin, ciprofloxacin, and even cephalexin for confirmed or suspected COVID cases. As a pharmacist, I get conflicted when dispensing these antibiotics, knowing the side effects and the spread of resistance. Yeah, and I do see when people have a more severe case, sometimes I've seen azithromycin. Don't quote me on this, but I do believe the BC CDC still uses azithromycin if there's suspected pneumonia. But using antibiotics like this for prophylaxis, just in case, can cause what we call, over time, can cause what we call bacterial resistance, antimicrobial resistance, where the antibiotics that we have do not work as well for some infections, and we are seeing that. That's going to be a huge issue. It already is. The pandemic has kind of taken over all other health issues right now, but I think that the next big health issue we're going to see, other than type 2 diabetes, is going to be antimicrobial resistance. And I would be concerned about that as well. And I would encourage you to maybe push back with the physicians, ask if this is really necessary. I know it's not always easy to do that in practice, but I don't think that there is recommendation right now for prophylactic antibiotics, and I don't think that that's good practice, in my opinion. Melamorph probably should be careful. Mucous membranes in the nose as well. Yes, and that's why it's important to also gargle, right, with this solution. Again, please make sure it's something that is meant for the mouth. Don't be using just any solution, salt water, even like Listerine. I don't like Listerine, but Listerine or one of those products. And that's why I like this product, because it does not burn the mouth. So yeah, would lining the outside and slight inside of nose with Vaseline be beneficial? I I don't know off the top of my head if that would be beneficial against SARS-CoV-2. I know that for allergens in the air, like for hay fever or during allergy season, that can be helpful to help block some of the allergens. So in theory, that could work, but I cannot speak to that specifically with SARS-CoV-2. And then the other concern that obviously comes up is really making sure you have good hand hygiene before you're putting anything in your nose, because you don't want something from a surface or from something to be getting into the nose. So definitely be careful of that. I would probably avoid putting anything in your nose, especially during cold and flu season, although I'm sure you're going to be very careful. So if you're just joining us, thank you so much. This is our first live today on Friendly Pharmacy 5. This interaction here has been really, really neat. Let me know in the comments what kind of videos or what kind of questions you have about healthcare right now, health topics that I could maybe address for you. Do you have questions about medications? Is there anything that really you're interested in knowing more about? Do you still want to hear about COVID-19 or have you heard enough? I mean, it's just kind of the reality that we're facing right now. Today is World Pharmacist Day, and so we're celebrating. Shout out to all of my pharmacy colleagues. I hope that pharmacists have been helpful for you. We've kind of been on the forefront, but also a lot of pharmacists feel that they haven't really been recognized that much during the pandemic. They've been one of the only things that have stayed open throughout the pandemic during lockdowns, as they're an essential service. And so I just want to come on and do something different for you guys today. So I've shared about the masks. I've given you a reminder about vitamin D, and you can get these in drops. So if the tablets are hard for you to swallow or hard for someone to swallow, they do come in drops, and you can get them so that one drop is like 1,000 units, right? Again, I'm not recommending what dose that you take. Talk to your pharmacist or your healthcare provider, but this is something that me and my family definitely use during the winter months to help with the immune system, to help with bone health as well, because vitamin D helps us absorb calcium in the bones as well. Hi from Albany, New York, USA. Hello, Albany. This is so exciting. There's people from all over here. We have people from London, people from Ontario. We have people from all over the place here, Algeria as well. This is great. And then I also did talk about the flu vaccine. So the flu vaccine is going to be launching here in British Columbia mid-October, probably across Canada at that time as well. So that's something that you might consider. And I did say before, I don't get the flu vaccine every year, and I'm not here to push vaccines on you, but it is something that we can do to help protect ourselves and to protect those around us as well. You're one of a handful of resources I go to for COVID-19 info. Thank you so much. Yeah, I mean, the COVID-19 information is just something that we're living right now, and it is something that's been evolving so quickly, and there's so much misinformation out there. So when I do bring you information about COVID-19, I do my best to make sure I'm bringing you the best information, accurate information. And actually, while I'm talking about this, there was, and I don't have the reference for it right now, yesterday, there was a report released on myocarditis, and I believe it was from Ottawa Public Health here in Canada. And the statement on myocarditis, so we know that the Pfizer and the Moderna vaccines, there is a risk of myocarditis, more specifically in younger males. Usually these cases are very, very mild, and they are very rare. However, Ottawa Public Health released a preprint yesterday about myocarditis, and the actual data on it was wrong. Was it the Ottawa Heart Institute? Yes, it was. Thank you, Melamorph. You're more up to date on this than I am. The actual data was wrong, and they had overestimated the incidence of myocarditis by 28 times. And this study was picked up by social media. It went around the world quickly. So if you are hearing about the incidence of myocarditis being much higher, that is false. And I don't have the exact stats as to what it is, but it is not changed. And what came from the Ottawa Heart Institute, it was, I believe, retracted, but it was up there for quite a while. So do not be alarmed. The incidence of myocarditis is not higher than what we already No. Are children catching, is that ARDS, acute respiratory distress syndrome? It's unclear. I assume that you're asking about COVID. It's unclear right now whether, sorry, just one second here. It's unclear right now whether, I'm sorry about that. I just had a glitch here. It's unclear right now whether children are catching this with a higher incidence than we saw before. What's happening, from what I've read, is that Delta is so much more transmissible, and children under 12 are unvaccinated. Now we are seeing this spread like wildfire through children. And so we are seeing in the United States that children are now, it's still fairly rare, but we are seeing children now being intubated, hospitalized. I haven't heard or seen the stats on deaths. I believe that's a little bit lagging right now, but they are getting this. I'm not sure with what frequency. And the other concern, and one of my viewers brought this to my attention, is the Ontario Science Table just released some data on long COVID. And so long COVID also happens to children. So when people say, well, we're not too concerned about children because children generally have mild illness, they generally do, and most of them are fine, and most of them will not die, thankfully. So we're not likely to see a lot of deaths in children. However, we are seeing that long COVID does happen in children. And so after these children, some of them, after they get sick, they are dealing with fatigue, sometimes myocarditis. I've not heard about blood clots, but sometimes they need physiotherapy after their infection. And so it is still worthwhile, even though we have this really transmissible variant and we're all tired of this pandemic, it's still worthwhile to protect children because they are getting quite ill. And now we see, like in parts of Canada, hospitals that are already overrun with COVID-19. And if we start to see a lot of pediatric cases, the hospitals are not going to be able to handle all of this, right? Let's just see what's going on here. I live in Toronto, Canada. I have a question regarding the tumoral necrosis factor blockers. I currently take Enbrel once a week. Are people on these tumoral necrosis factor blockers more susceptible to COVID? I don't have a study on that, but I would guess so, because that is immunomodulatory, and that is something that would compromise your immune system to react. So don't quote me on that. I'm going to write that down, and I'll try to get back to you on that. Mama Bear, have you been vaccinated? Is my next question for you for COVID-19. Tumor necrosis factor blockers. Rheumatology Canada had some very good resources on this as well regarding the COVID-19 vaccine and regarding COVID in general. That's a resource that you could maybe have a look at too. My son lives in Canada now and says he's never coming back to the US. I'm 64 and live in North Carolina. I have shared your advice many, many times. That's wonderful. I'm glad to hear you shared it. I'm sorry to hear about your son. I mean, the CDC has actually put out a warning. This was a few months ago, and it's happened a few times, for Americans not to travel to Canada, because we are not in a good state here right now either. So I think that, and I know that our border is still closed, and that was a decision, I think, by the CDC, our land border. So it's not that great here either. So you can let him know that yeah, it's difficult. This is a good question. Sue Perea, hi Sue, is saying, should I get a COVID test before getting the flu vaccine? You probably don't need a COVID test unless you are symptomatic. With flu vaccines, we do not recommend that anyone, or any vaccine, that anyone get a vaccine if they are symptomatic. So if you have any kind of, like, you're just feeling a little bit ill, runny nose, or you're just getting over a cold, we usually tell you to come back. And often your pharmacy will actually, because there's been so much demand for flu vaccines in previous years, especially last year. If you let your pharmacy know and you have an appointment that's scheduled, because flu vaccines will be by appointment this year, your pharmacy, your pharmacist will save a dose for you. Okay? You can ask them that. You can tell them that I told you to save a dose, okay? Because we do that because we love our customers. And if you've had an appointment, we have a dose reserved for you. We will save your dose and we will give you a dose when you are healthy. So you don't need a COVID test. Now, another question that might come up is, can I have the COVID-19 vaccine? What if I just had my second dose of COVID-19 vaccine and I want to get the flu shot? This is different in every province, but right now in British Columbia, there is no discrepancy as to the timing of your flu shot and your COVID shot. So right now, assuming nothing changes, because we know with COVID-19, things can change fairly quickly. If you've had your COVID-19 shot, say yesterday, and you're feeling okay, technically, you could get your flu vaccine today if they were available, which they're not. But no, you do not need a COVID test to get your flu vaccine. But if you are symptomatic with another type of illness, whether it be COVID or not, then you should definitely postpone the vaccine, call your pharmacy and let them know, say, hey, I'm just not feeling very good. Could I reschedule my appointment? And they'll definitely do that for you. If they don't do that for you, then go to another pharmacy because we do that for people all the time. Mama Bear, yes. I've had both shots. Happy Pharmacist Day. Thank you, Tina. Thank you for the work you do. Yes, today is World Pharmacist Day. And so that's why we're doing a live today to kind of celebrate. But if you like this live, let me know and I'll do this more often. We're getting some really good questions here about COVID-19 and about the flu shot and the COVID-19 vaccine. I also wanted to share with you, I had the Moderna vaccine. I've had 2 doses of it. And the first dose, I'll just share with you my experience quickly. The first dose of the Moderna vaccine, now we're now seeing that the Moderna vaccine is somewhat superior to the Pfizer vaccine. So it's interesting because I remember in Ontario and different parts of Canada, a lot of people were walking out of pharmacies and flu or COVID-19 vaccine clinics because they did not want the Moderna vaccine. I liked the Moderna vaccine from the start, and I'll tell you why. One, it was showing some evidence of sterilizing immunity, meaning that it decreased the ability or almost eliminated the ability to transmit the virus, but that was shown in mice, and now we know that you can transmit, but that was early on. Also, it was more stable. So it was fridge stable from the get-go for 30 days, whereas Pfizer was in the beginning, if you'll remember, Pfizer was -70, had to be stored at -70, so it was not as stable. Moderna has been working on mRNA vaccines for I think about 10 years. So their lipid nanoparticle, they've had more time to kind of perfect that. And so I believe that their lipid nanoparticle was more stable. I mean, it was able to be refrigerated right off the bat, right? So when I went to get my COVID-19 vaccine, I did not know which vaccine I would get. It's not like a buffet here. You don't get to go in and choose. And I asked them, what vaccine am I getting? And they said, oh, you're getting Moderna. Fine. I got the Moderna vaccine. Now, with the first dose, most people don't feel anything. I was actually pretty tired for a few days. I did not feel great for a few days, but I was able to function and it was fine. And then my second dose, I delayed a little bit because I know that the literature is showing that a longer interval between doses is actually more beneficial. So I delayed it. I had my second dose about 9 weeks after. And I think the ideal dosing time we're seeing is maybe between 7 to 12 weeks. So I had it 9 weeks. I was very, very sick. So I had it around 5 p.m. I was fine that evening. Around 10 o'clock, I started to really feel my arm was very sore. During the night, I went to bed, didn't expect anything. I woke up during the night with chills. Have you had your COVID-19 vaccine and gotten chills during the night, or what were your side effects? Let me know in the comments. I'd be really curious to know. I woke up, I was so cold. And I know that, you probably all experience this when you get a cold or flu. That day, I barely got out of bed. I was just feeling everything was aching. I didn't have a headache, but I was very nauseous. And my arm was sore, but that wasn't the worst thing. The worst thing for me was that I was nauseous and I was really, really cold. I did not have a fever. Fever is a very common side effect of any vaccine, but also of the mRNA vaccines. So I was very, very ill that day. I did not get out of bed. Now I have a friend who had the Moderna vaccine, 2 doses. She was fine. She actually didn't need to rest or anything like that. Look at how our immune systems are so different. And then her husband, very, very healthy, same age as me, no health conditions, he was in bed all day, about 30 hours in bed. So that's my experience with the Moderna vaccine. When I was that sick, I was laying in bed and I thought, I am so happy that I am not getting COVID because I'm going to be protected from this vaccine. I cannot imagine how bad COVID could be after I felt like that. So I'm really happy. I would do it again. And honestly, if they had given me Pfizer as my second dose, or I did not care what the dose was. It just happened to be that it was Moderna and Moderna. So that was my experience. Let me know what your experience is. My first shot was AstraZeneca. My second shot was Moderna. Yeah, this is interesting. What a mess this AstraZeneca caused for us. And some countries are not accepting it. Yeah, AstraZeneca made me so sick. Was that your first dose or second dose? So usually we see with the AstraZeneca vaccine, people reacted worse to the first dose, and then the second dose was, in most people, was not as bad. Whereas with the mRNA vaccines, we see that the first dose is usually not a big deal. The second dose, when your body gets exposed to that spike protein again, it really causes anger in the immune system. Yeah, and the AstraZeneca vaccine, I mean, it has been a bit messy, especially in terms of communication. But there was some evidence early on that mix would give you almost superior immunity compared to some other dosing like Pfizer, and I presented on that a few months ago. So I think you're well protected. But I do understand there are issues now with travel, right? Because not all countries are recognizing that dose, right? Can you speak about Sinovac, Chinese vaccine, and Sputnik? Have you seen the literature about their efficacy? I have not. I know that I've seen more about Sinovac than I have about Sputnik, but I will look into that for you, especially against Delta. I've not seen too much on that. If I got the J&J vaccine in March, should I get the same booster when it's available? Or could I get the Moderna instead, as I've read that J&J is not as protective? Yeah, I don't think that it matters. It's important to remember that your immune system does not know which vaccine you've had. It's merely exposing your body to the virus itself. So the way that that I understand the immunology, and I really read up on this when this was going on, because in Canada, the mixing and mashing has not been uncommon. It's been actually fairly common in some places. So I would not hesitate to get whatever booster you are offered. And the mRNA vaccines, so be it Moderna or be it Pfizer, I would just take whatever you are offered. I would maybe give a bit of preference from what I've seen to the mRNA vaccines as a booster, but I would not be concerned that because you had J&J, you should get J&J again. I would not be concerned about that. And from what I've seen from J&J, that's kind of where I would be at with that. I would not refuse a vaccine, but I would tend, from what I've seen in the data as of today's date, September 25th, I would tend towards maybe mRNA, be it Pfizer or Moderna. Do you have any feedback on the viral loads transmissibility from those who have been vaccinated compared to those who have not? Yes, and from the studies that I have read, is it looks like people, well, what they've seen is that people who have been vaccinated can transmit, and they can transmit fairly high viral loads. However, it's for a much shorter period because their body is able to clear the virus much quicker. So there's this argument of, well, if people who are vaccinated can still transmit, then what is the point, right? And there is a point. The point is that you are protected from getting severe disease. And then also, if you are transmitting, it's for a much shorter time period. And that's what the data is showing as of right now. So that's what I can say about that. And it makes sense, because if your body is able to react to exposure of the virus, it's going to clear it much quickly than someone who is not vaccinated, and this virus is just circulating, and it's just, you know, attaching to that ACE2 receptor, and it's starting to infect other cells. So definitely is benefit in that. One more question here. After vaccination, if I'm exposed to COVID-19 and contract it, would I have a more robust, broader spectrum immunity if exposed again? Yes, and I was actually looking for literature on this yesterday, both about natural infection, so infection without any kind of vaccination, but also post-vaccination if you get it. And I would think that if you were exposed post-vaccination, that infection would probably, in theory, based on the immunology, act as more of a booster, right? So you would probably get a fairly mild infection. That immune system would be triggered again. The memory, we call it immune memory, would be triggered, and that would give your body a little boost as far as immunity goes. Now, how long that lasts, the data is still coming out on that. How long that second exposure lasts is still a little bit unclear. But we are seeing very good data in terms of memory after the second dose. And as we know, booster doses are starting to be recommended, but it's in immunocompromised people. And also in places like Israel and the US, where they had that shorter dosing time frame, and they also had predominantly the Pfizer vaccine, which is showing to be somewhat less effective than say the Moderna vaccine, then we see that immunity start to wane. But there are different factors involved in that. So yeah. T cell longer term immunity, yes. Do the vaccines only offer protection against one variant? No, the vaccines are offering excellent protection against all of the variants. I have not seen data yet on the most recent, the C12 variant. That's not a variant of concern yet. And we did see with the South Africa variant, I can't remember the name of that one, I think it's the Gamma. That one did show a little bit of decreased efficacy. However, all the vaccines are holding up quite well against all of the variants. So that's really good. We are seeing that there could be higher infection rates, but there's still, when you look at the efficacy rates of these studies, they're talking about efficacy in protecting you from symptomatic disease. So a person who was in a clinical trial and they had, say, a fever or a cough or something like that, and then that reduces the efficacy of the vaccine. However, you need to look for the efficacy in reducing severe disease, hospitalization, and death, and that is extremely high. I believe with the Moderna vaccine, they're still in the 90s, I believe. It might be 88% or 90%. It's still offering very, very good protection there. So we are seeing long-lasting immunity. Especially with the longer dosing interval. That worked out well for Canada and for the UK, but we are seeing that in the US and Israel, maybe that's starting to compromise a little bit their immunity there. Just a couple more questions. I'll definitely do this again. Let me know if you've enjoyed this. I can do this like monthly if you like, and let me know what topics you would like me to cover, because I'm happy to cover COVID-19 and happy to cover other topics that are important to you as well. And let's just see a couple more questions here. Okay, so should we get a third booster? If we don't, will we be okay? Third boosters right now are only being recommended based on need and based on what they're seeing in efficacy in terms of immunocompromised people. Now, if we can get community transmission down, and if we can kind of get rid of this virus through vaccination and public health measures, then we wouldn't really need a booster necessarily. But if we start to see more variants and high community transmission, I just did an interview with Dr. Rewat Diananan about this. And if those community transmission levels remain high, then we get more spillover and there's more infection. And then there's more chance for these variants to be to be, I don't know, created is not the right word, but I think you understand what I'm trying to say. So getting a third booster would only be recommended if you have a condition that is proven where you would not have a very good immune response. So that's looking like possibly in people who are elderly, and then also in people who are immunocompromised or on medications that would cause them to be immunocompromised. So like monoclonal antibodies, certain medications for rheumatoid arthritis, steroids, not short-term steroids, and I'm not talking about asthma inhalers that are also steroids. We're talking about high dose, longer term steroids that are used sometimes. So absolutely have enjoyed this live chat. Yes, I've enjoyed it as well. So I'm going to stop there. So you've seen the masks from Masks for Canada. You've seen my vitamin D. I'll keep you updated on the mouthwash. Thank you so much for joining me. Today is World Pharmacist Day. I wanted to do something different. Shout out to all my pharmacist colleagues there. Thank you so much for watching, for being part of this friendly Pharmacy 5 community. I will definitely do this live again. And next time I will give you some notice. You can send me your questions in advance. Let me know in the comments if there's anything else you would like me to cover. Thank you so much for joining me. I hope you all have a wonderful weekend. Take care and stay healthy. Bye-bye.